Good evening, and welcome to A Grieving Mother's Journey, Lakeland, where we air every Sunday from 6 p.m. to 7 p.m. with open mic every third Sunday from 6:20 to 6:50 p.m. We bring grieving mothers together to share, trust, and bond with one another, and to spread awareness of the pain that is caused when others choose to take a life by violence, and the various struggles we face on a daily basis just to make it through the day. I hope that this will make those that are on that horrible path think twice and turn their lives around. Welcome. Well, good evening, everyone. Thank you for joining once again. You are now viewing episode 36, where we will be speaking about broken heart syndrome. We do have a wonderful guest that's going to be joining us here shortly, Dr. Patrick Callahan, who is a pediatric cardiologist, and he will share his wisdom on that as well. But before we bring him on board, I want to just say a couple of announcements. As you guys know, that's been following me for a while. I do the announcements first. So the first announcement I have is I made a post not too long ago regarding the other side. I hope that someone has seen it or someone that is interested. We would like to hear the story from the other side. If you committed murder and you've done your time and you're remorseful and kind of want to share a little bit about your story, we'd love to hear from you. Just send me an email and let me know. We'll bring you on board. All the information you need is scrolling at the bottom. The phone number is scrolling at the bottom. The various platforms that I have, as well as the phone number and the email. The other thing I wanted to mention is suggestions are always welcome. I know I've said this a couple of times. We did have one of our members in our group that actually suggested a topic, which was forgiveness, and we were able to make that happen, and it was a great success. So just remember, this is a group that I created, but this is a group for us. So all suggestions are welcome. Just go ahead and just either put it in the group page, send me an email, and we'll put it together for you. The next thing I wanted to mention was if you or anyone that you know has lost a child by police officer, we'd love to hear from you as well. We'd love for you to share your story on that. Again, same thing, just contact me. The best way to do it is to send me an email. I'm not on the Facebook all the time, but I do get notifications a lot for the email. So if you want to come on board and share your story, we'd love to hear from you. Now, as you guys know, and I've said this a million times, I run a no pressure, no judgment zone. So if you are not comfortable with showing your face or even putting your real name when you come on the platform, you don't have to do that. You do have options. So just hit me up. We'll talk and get things together. The phone lines will open up later on, probably around 6:30. I'll give you the clue. Just make sure you give us a call. And if you don't have anything to share regarding broken heart syndrome, just give a call and thank Dr. Callahan for even sharing this information with us. And that would be awesome if you could do that. But feel free to call in when I give the cue. And if you do want to join our platform tonight, just remember the link has been placed on our group page. If you want to come on in, you can ask Dr. Callahan a question. You can, speak on whatever, or when the phone line's open, you can go ahead and give us a call and share that way. Last but not least, I would like your feedback on our open mic. We don't have that all the time. We've had a few. They have been successful. Just kind of share with me. Do you like it? Do you want it to keep going? Do you have any suggestions for the open mic? Again, I'm always open. Just let me know. And we do need to send a big, big prayer up for one of our biggest supporters, Deborah Tefteller. She is the creator and owner of her group Facebook page called Wake Up Before You Don't. She's lost a child to fentanyl. Everyone in her group has lost a child or a loved one to fentanyl. And they're an amazing group of people. But Deborah's granddaughter fell out of a 2-story window today. She has been taken to the hospital. So far, there's been no broken bones, but they're still kind of working on her. So let's all send a big prayer up that all will be well for her. So I'm getting ready to introduce Dr. Patrick Callahan. Again, he'll be speaking on broken heart syndrome. Ladies, this is a real thing for men too, but I believe it's about 90% of women suffer more from it. And, it can take your life. So this is an important episode. Take heed. I want you guys to, be informed and educated so that you can take care of yourself to prevent this from happening to you. So, Dr. Callahan, again, it's like I stated, he's a pediatric cardiologist. He's amazing. And just a quick, brief story on that. Those of you that know me, I do have a daughter with Down syndrome, Najee. She is 22 now, but Dr. Callahan basically took care of her for about 19 years. She had heart surgery at 4 months old. And she's been, ever since then, after the second year of her life, it's been amazing. She's healthy. She hasn't really had any issues with her heart. And for those of you that do know anything about Down syndrome, it's pretty common for Down syndrome babies to have multiple heart surgeries. Well, my Najee has only had that one 22 years ago, and she's wonderful. He was amazing with her. So he'll tell, give a little bit of background and some information. If anyone out there is in need of a wonderful pediatric cardiologist, hit him up. He'll give you the information. So without further ado, I am going to bring Dr. Patrick Callahan on board. Hello.
How are you?
Can you hear me okay?
I can hear you. You hear me?
I can hear you, but it's very, very low.
Okay, let me see if, how do I adjust my microphone?
There we go. I can hear you better.
Interesting. I didn't do anything.
You didn't do anything?
I clicked on the three buttons. Is it still good?
Yeah, it's a little better.
Okay.
I guess listeners, if you're out there, if you are having any issues hearing, please just let me know. But I can hear you, just a little low.
Let me see. Is that better?
It's about the same.
It's about the same.
Is your volume all the way up?
Well, I'm looking at the volume on this, and it looks like it's okay. I'm a soft-spoken guy. Let me see what. Let's see. I guess it was better earlier, huh?
Okay. Well, actually, so my daughter, she just responded in the comments and said that your volume is fine, so we are good to go.
Okay. Good. All right.
Good.
So, yeah, 22 years. Wow. That makes me older. So
me too.
Yeah, I've been doing this for almost 30 years in pediatric cardiology after my training. So, just what is a pediatric cardiologist? A lot of people don't realize that there's heart disease in kids, and we need a specialty for children. And I take care of babies from about 15 weeks gestation on through sometimes in their young 20s and 30s, if need be. Sometimes parents just don't want to leave me. But in general, we transition many of our patients to an adult congenital heart doctor after college. The adult congenital heart doctors would like us to transition them earlier, but we generally kind of make cutoffs at certain points of people's lives. Either they're leaving town or they're moving after college or something else. We try to find them a place to be followed up. Did my training in Washington, D.C. at D.C. Children's Hospital, Children's National Medical Center, and for 7 years after medical school in Syracuse, New York. And then, so 7 years, 3 years of pediatrics, so a pediatrician first. And then I did 3 years of pediatric cardiology fellowship and an additional fellowship in pediatric and fetal imaging of the heart with both
Wow.
MRI and echocardiography and fetal echocardiography. So some of my specialty is diagnosing the heart conditions before birth, sometimes treating babies before birth, and helping to manage the stress that goes along with finding out that you have a baby with congenital heart disease before birth. So sometimes there's people who oftentimes have they fear the loss of losing a normal pregnancy. So it's a grievance that they have at that time, as opposed to, and that might be harder because it might be 4 to 6 months of time that they're grieving before the baby's even born, not knowing exactly what's going to happen, versus a baby that's born without the knowledge of a heart condition that is, parents are expecting everything to be normal, and then we take the baby because of a heart condition and maybe do surgery within a couple of days. Some can go on for a few months before we need to do surgery, some even longer. But there's many babies. About 1 in 100 babies has a heart condition. About 3 in 1,000 will need surgery in the first month, and then many others will need it in the later part of the first year or beyond. Sometimes we don't diagnose conditions until much later. Sometimes it's not diagnosed until adult life, and we can assist in the adult cardiologists with their concerns. So pediatric cardiology, when it comes to broken heart, certainly we have lots of broken hearts in our of parents in our ICUs if things are stressful. Even our nurses and our doctors will be under a lot of stress for some of our kids, especially if we take care of a lot of children that come in with overdoses or with cardiomyopathies that come on from a virus or from something else sometimes. So despite some of the rhetoric that's being discussed right now about how children are very difficult to make ill from a virus, we see a lot of children who don't survive things like the flu, measles, and other common cold viruses that might impact a specific individual adversely. But Takotsubo cardiomyopathy is what you asked me to speak about.
Correct.
And
that's where it was derived from, the broken heart syndrome, correct?
Right. So Takotsubo cardiomyopathy is what broken heart syndrome is otherwise known as, probably better known as broken heart cardiomyopathy. When you asked me if I could speak on it, I knew exactly what you were talking about, because in the 90s I had gone to a conference and I learned about it, and we were doing MRIs on some of these patients at the NIH when I was doing some research. So the Takotsubo, so it's a Japanese. It was diagnosed first or identified first in Japan in the 1990s, and it was found it's a form of cardiomyopathy, which means that the muscle doesn't work well. In this situation, the apex of the heart, the bottom, the tip of the heart of the contracting chamber, which is the left ventricle, balloons out into a shape that looks like a octopus jar.
Right.
It's a jar that in Japan that they have at the bottom of the sea that the octopus will crawl in. And I assume that's how they kind of capture some of the octopi for in a way efficient.
And that's why they named it that, because of the shape.
Because it looks like, and it does. If you look at it on an angiogram, it looks just like one of those resting on its side. It's amazing.
Yeah, that's crazy.
So it's not a real common condition. It is, as you mentioned, more common in women. About between 80 and 88% are the quotes that I will find when I do some reading on it. It's not something that we typically see in pediatrics. Generally, it's more common in the age group of 50 to 90, and it is more common in women, although it occurs in both. And it's kind of one of those things that there's a whole medical condition of widowhood that occurs in people, not just women, who lose a spouse or a significant other, where they can have all sorts of mental health concerns and they can have cardiac concerns, and one of those might be this, or sudden death in some situations. Sometimes people, we've all heard of stories of long time married couple who die within a few weeks or months of each other.
Yes.
So that may be some of that, and it's generally not some sort of genetic syndrome. Certainly there may be predisposing risk factors to any medical condition because of underlying health concerns that somebody has that might make them more at risk for dying suddenly. But it's a real thing that we all. It's in movies. It's in newspapers. It's in books. So we hear about it, and we probably all know somebody. I did want to share. One of the things that brings on this sort of myopathy and why this is a topic for this group is that it occurs in grieving. It occurs in stress. It occurs in some acute traumas.
Absolutely.
In your life. And from your introduction and your announcements, I can tell this is a situation where many people are going to be under stress and under sudden grieving.
Yes.
And, so there is not a genetic predisposition that we know of at this time. So there's no gene that we can test a bunch of people on 23andMe and whatever gene platform you might do that says you need to control your grieving when you have a sudden loss because you're at risk. There's nothing like that yet. We don't know that yet. But there have been familial cases. The good thing about it is that most of the patients will survive within a year and improve.
Awesome.
Some will not, and some will die, and some may go on to need a heart transplant. And I was going to share.
So there's a possibility of a heart transplant with broken heart syndrome if it gets that bad?
If it gets that bad, and that's the only, if you're not surviving, if you're not getting better with medications.
Wow.
Many of the medications that we would give for cardiomyopathy, diuretics, which are water pills, beta blockers, a medication called an ACE inhibitor, which is like captopril, enalapril, lisinopril. Those medications have been used for treating patients with other forms of heart failure and are also used in this condition. And in general, they can get better, and it just takes some time for that to improve.
Got it. So one of the questions that I have, I mean, I kind of know, but I know, I'd like my listeners to know as well. So what are the symptoms that my listeners could look for as far as possible broken heart syndrome?
It's like a heart attack. So chest pain, shortness of breath, easy fatigue, sweating. Somebody might recognize that they're fatiguing much more easily. They look in the mirror and they see veins kind of sticking up in their neck that's different for them because their heart is failing. So it's the blood is not flowing down towards the heart, so it's backing up.
Oh.
In that situation, maybe they could have dizziness, lightheadedness, and headaches for sure in those situations. But it can come on acutely, like a heart attack, and it could be a little bit more gradual before it's
okay. Awesome information. So you kind of already.
Yeah. Sorry.
No, you're fine. You kind of answered one of the questions I had with, the treatment with the different medications and things like that. Um, what? So I know you mentioned that the cause of broken heart syndrome, was basically brought on by stress, right?
Correct.
Stress, extreme. What is that word I'm looking for? Pain, basically trauma, extreme grief. It can be brought on by that, but it can also be triggered. I think you had mentioned something about this by a serious illness or even surgery. Is that accurate?
Well, any sort of stress is going to, and certainly stress is brought on by surgery, whether it's surgery in yourself or surgery in a loved one. Um, uh,
Ah,
Generally, viruses, to my knowledge, have not been implied or implicated in this condition. There's certainly other
okay.
forms of cardiomyopathy that come on because of viruses,
Got it.
different
Okay.
dilated cardiomyopathies, or um, and some some will come in with myocarditis, but that's not Takotsubo cardiomyopathy.
Okay.
The And those can also get better. Usually in a viral cardiomyopathy that we see somebody come in with a heart that's not functioning, we start treating them. We generally, and this is held up over the years, about 30% will get better, 30% will get a little bit better, and 30% will go on to need transplant or die.
Ah,
So, and that's in any form of cardiomyopathy, whereas this broken heart syndrome tends to get better.
okay. So the chances with broken heart syndrome, the chances of them getting better are a little bit greater than any other condition concerning
If it's this,
if
if
it's
it,
correct.
right,
Okay.
there are other conditions that you can be genetically predisposed to, such as long QT syndrome, that might come on during sudden anxiety or exercise that could lead to a sudden abnormal heart rhythm and sudden death. So
Okay.
those are the conditions you might hear about people collapsing some of them on a sports field, uh,
Okay.
or they get a sudden shock and they might collapse in those
Okay.
situations. So that would also be in the differential of somebody with a broken heart syndrome or the widow effect. Generally, most of those patients that have long QT syndrome are younger, and there's often a family history.
Okay. Okay.
But you might be the first in the family history, because not all patients will. So if you are diagnosed with sudden death and don't survive, or do survive because somebody resuscitates you and starts the treatment, the rest of your family should be worked up for.
Oh,
And
wow.
even with this form of cardiomyopathy, you should probably have other family members worked up, because
Okay.
maybe there's a genetic predisposition.
Awesome
Um,
advice.
my daughter had a friend from college who, in her early 20s, had a lot of stress. She had just finished a master's program in business. She had been trying out. She was a dance team member at a university down in the South, for a college, for all their basketball. So she was in really pretty good shape, and she was trying out for one of the NFL football teams as one of their dance team members. It used to be called cheerleaders. Now they're dance teams. So she was in pretty good shape. She had gotten into a relationship pretty quickly with a guy that seemed to move very quickly. They had just gotten engaged, and right around that time, she found out that he killed her dog, and then was cheating on him.
Oh,
So a lot of different trauma um, impacted her right away. And I don't know. I don't have all of the details of things,
right.
but she then developed symptoms that were similar to what I explained: the chest pain, the maybe dilated veins, shortness of breath, And she went on to require a transplant a year later, and is doing fine right now. And
Awesome.
is happily married now. And But it is a situation that she felt lucky to have a trauma that brought her out of a bad situation,
Hmm.
and changed her life. And now she feels she has a much better outlook on life.
That's awesome. Thank God for that.
Yeah, but so trauma comes in all sorts of different ways in our lives.
Right. And not just like, excuse me, even though this is tailored to drama from the loss of a child,
Right.
within this group, but it affects, it could be a loss of not just a child, any type of grief,
Right.
or trauma could onset the issue with broken heart syndrome.
Correct.
So, so before we open the phone lines, there's two things. One, I had one more question that I wanted to ask, and the other one, we do have a comment that Raven, she did mention. She said, "Did I hear him say shortness of breath is a symptom?"
Yes.
Yes, that's that's one of the symptoms. Broken heart syndrome is the symptoms are very close to a heart attack, and shortness of breath are one of the symptoms on both ends. Is that accurate?
Correct. If you have a heart that's not working well, then your blood is basically backing up into your lungs and causing it harder to breathe and harder for deoxygenated blood to pass through your lungs to become oxygenated. So you're not supplying your body with enough oxygen to carry on your normal daily activities. So even walking a short distance could be very difficult.
Wow.
There's different grades of heart failure. There's heart failure without, there's heart failing without symptoms. Then there's mild symptoms and then there's more states, class 3 and class 4, where you become more disabled with your cardiomyopathy.
So, is it possible for someone oh, oh my, I'm sorry, this is my grandbaby. Maya? Maya? Maya. Okay, maybe she dialed me by accident. I apologize. So the question, is it possible, and I think I read this somewhere, where you cannot have symptoms right away and pass away, and during the research or the autopsy or whatever, then they can determine that it was from broken heart syndrome? Is that a
Sure.
thing?
If they would look at the shape of the heart,
Okay,
yeah, they could get that from the external appearance of the heart.
got you. Okay.
Or they can make that assumption. Yes.
Got you. So the last question I had was something. Could you tell my listeners? And before I say that, by the way, Autumn, if you're listening, I saw you come on board and go off again. If you're still listening, please come back on board. I saw you there. I will bring you up shortly. But Dr. Callahan, so what would you suggest, or what could you tell my listeners to do to try to prevent broken heart syndrome? What can they do
There's
in
there's
this
not
case, like in
there's
in
not
this scenario?
yeah there's not a situation where I think when you have a um, sudden loss can come on gradually, right? So you can have a sick parent or a sick child who is maybe getting better or is doing okay, and then suddenly dies, and maybe you were preparing for that possibility because you know it was a possibility, but then you could have this situation because of that stress and maybe because of that suddenness. The getting help, being asking for help with mental health is going to
Okay.
go a long way. People who I mentioned that there's not a genetic predisposition, but there may be conditions that make you predisposed, such as people with anxieties and other neurological conditions.
Okay.
Sometimes epilepsy increases your risk for this sort of thing.
Wow.
And so getting help, being healthy, staying healthy, finding ways to eliminate stress in your life. Um, having those people that surround you that are good people and lift you up and are there
Mm.
for you. So anything that de-stresses you would be helpful. And
Okay,
that,
so basically, listeners, what he's saying is really just kind of do your best to take care of yourself, eat healthy, exercise, try to eliminate stress, things that you can do to do that with, meditation, things like that. Now, what about sleep deprivation? Because I know that's one of the things that I suffer from. I have, because of my anxiety, the PTSD, the trauma, all of that plays a role in my sleeping habits, which have been very, very bad. Um, but I did find some things on YouTube, like meditation videos and things like that, that help me to fall asleep.
there
But
are different. You mentioned meditation. Meditation would certainly be something that you could do, some sort of mindfulness activity. The Calm app, CALM, is a great app for meditation and
okay,
stories and music and sounds, so that you can get yourself into a better sleep and be more relaxed.
okay,
Um, sometimes it's listening to the right kinds of podcasts. And
true,
sometimes, if you are finding the need to come and be comforted by a podcast like this, you may need to find one that's less stress provoking as well, because this certainly is, getting on a podcast like this that's trying to be really helpful could also be triggers for some people. So
true.
you need to find something that is going to be calming and helpful. Although this is helpful, there may be others things, and whether it's books or whether it's you mentioned a run. So do something that you can kind of get out of your head for a little bit.
Oh, yeah, I was going to say that too. Yeah, maybe because it's really hard for us moms and dads to not think about that trauma, especially, when we've lost a child, to gun violence. Um, it's hard to get that out of your head. However, I totally agree with what you just said, because there have lately, um, because, I'm almost 3 years in now, and lately I have been able to go for a while, without thinking about it. And, the stress does come down. Not to say that I don't think about my son, um, but sometimes you need that getaway time to just focus and, like you said, meditate, um, on that. So,
We've gotten away from many people in the U.S. Have gotten away from maybe prayerfulness and using the quiet time in a church, for instance, to go, and maybe many of their churches are locked during the day when there's not a service going on.
mm,
But like my parents and grandparents would have gone to the church, lit a candle, sat in the pew for a while, praying, thinking about good things, asking for help. Um, you may not be you may be in your head, but you're asking for help and you're praying. So
okay,
you are seeking help from your faith, from what it is that you believe in. And sometimes
right,
people don't have a strong faith, and they might still go, maybe I'll find faith by going into this church and sitting and seeing what happens, see how I can find this peaceful place, because it is generally a place where you can sit by yourself and be quiet.
right.
And I think
Yeah, and the
I
thing of it is, with the faith part, coming from being raised in a Christian household, um, when and I can probably speak for most of us, maybe not all. Um, After the death of a child, some people tend to lose that faith.
Sure.
They kind of, because now you're getting into, now you're blaming God. And I can speak on this because I went through that, right? And I know people that have, for a little while you blame God, so you steer away from the faith.
Sure.
But eventually you come back. It's a learning experience when you lose, a child, especially to homicide. Um, that the faith thing kind of goes out of the window, but it eventually does come back. So, and I know, I have people in my group that have actually been through that and have already come back. I have some that are still kind of going through that, and some that are still kind of in the middle, which is where I am, kind of in the middle. um but that is an awesome suggestion, is to, because like you said, most of the time they're closed during the day, so you have that peacefulness. You are in the house of the Lord. So it would kind of, for those that have gotten back to that point with their faith, that would be an awesome suggestion as well. And for those that haven't gotten to that back to that point yet, just keep that in the back of your head, that is a great option when you get there. As and we all will eventually.
You might,
Um,
in the whole process of grieving, you certainly have the denials, and then you have the anger,
mhm,
and it might be okay to go in there and yell at God. And
true.
in that situation, you may find somebody come up to you and help you, and reach out to you, and
Absolutely. I like that.
try to calm you down. So I'm not advocating that, but I'm saying that you can be angry and still go into a church and try to reconnect with your faith, or think that you're not reconnected with your faith, but you go in for a reason, and you're angry, and that's
Right.
normal. And I think that I've not had that. I haven't had this situation, fortunately, and certainly I've lost a parent, but it was a situation where they were older, it was peaceful. He went on his own,
Yeah.
and it's not that it's not hard. It's
Absolutely.
it's just, and maybe my medical training has allowed me to come to grips a little bit more with loss than other
Yeah.
people.
Probably so.
Maybe, yeah.
Yeah.
Um, so I have to be there and present in mind for my patients and for the families when I take care of
Absolutely.
children with heart conditions. It's an entire family that we take care of.
Absolutely. Yes, that must be, I mean, God bless you. That has got to be the most hardest, but the most rewarding job, especially dealing with children, with, dealing with the heart and things like that, and family members. Well, I know.
It's,
I
it's,
went
a,
through it, so I
it's
know.
an amazing situation to have them get to be 22 and have the opportunity to say, now you're graduating, now you're an adult.
Yes.
And there are many kids who don't have Down syndrome, don't have other genetic, maybe disabilities, who are going to live a pretty normal life, and many of them had a 3% chance when
Mm,
we started out doing this, and now they have a you know 70% chance or 65% chance of having a good
mm,
quality of life. And certainly there are thresholds that they still have to pass through, and
right.
as they go on, and they're going to need to see a cardiologist all their life. And even with Takotsubo cardiomyopathy, you're probably going to have to check in every now and then.
Okay.
So
Well, it's 6:40. We have questions, and I do want to go ahead and open the phone lines. The phone lines are now open, listeners. Please give a call in if you have a question, or if you just want to say thank you for Dr. Callahan for coming on and sharing this valuable information with us. And so Raven says, so if someone has those symptoms, how would we be able to tell the difference between it just being a health problem or if it's from a broken heart, if it's from broken heart syndrome?
Well, you'll have to be evaluated. So you'll have to go see your doctor, maybe go to an ER if you're feeling like it can't wait. If you're having the chest pain that feels like a heart attack, you should go into the emergency room if you can't get a immediate appointment. Sometimes you get that appointment with your doctor, and they will send you to the emergency room, or they'll send you to the hospital, admit you. You'll need testing. You'll need an EKG. You'll need an echocardiogram. The difference between a heart attack and this form of cardiomyopathy is the coronary arteries are completely normal. So they'll do an angiogram, and coronary arteries are completely normal. So it feels like a heart attack, but it's not. So you'll need to go through all of that as part of the workup.
Okay, right. Yeah,
So
I do remember reading that.
Don't do it on your own. Don't try to figure it out.
You heard that, Moody? And so Diamond, she commented and she said, thanks for the information. A lot of stuff I was not aware of. And then Kay, which is Najee's older sister, she said right to Diamond, she was like, I'm shocked. So that means you're doing an awesome job. If anybody wants to call in, we have about 15 minutes left. We'll continue until you call in. Please feel free to call in, ask a question. And again, Autumn, if you're still listening, I did see you try to come on board earlier. Please come back on. We're not ignoring you. Or you can just give us a call. And so I guess while we're waiting, so basically, we can kind of dismiss the fact, dismiss fact or myth. So we know that broken heart syndrome is a thing,
Right.
And it's not a myth, that it's real.
Now you can have a panic attack.
That was my
Sure.
That was my next thing I was going to ask. So is it
you can have anxiety and a panic attack, and it can feel very much like that. And maybe you're short of breath with that, but it's generally if you pass through your panic attack and you feel better and you're normal, then it's probably not the Takotsubo cardiomyopathy. But if you are, certainly if you're prone to panic attacks and you're used to them, but some patients with anxieties and depression and neurological symptoms may be more predisposed to this. So if you have had a sudden loss or sudden trauma, that may be a trigger for this sort of cardiomyopathy. Then
I'm so sorry. I'm sorry, Dr. Callahan. We have a caller. Hold on one second. Thank you for calling the Grieving Mother's Journey. Hi, Butterfly.
Hi. How are you guys?
Good. Can you hear her, Dr. Callahan?
Yes, I can. Yes.
Awesome. So did you have a question or a comment or kudos?
Yeah. Man, I had a question. Well, I have a question, I guess. Everyone that knows me knows I could be a hypochondriac, and I know that, and I understand that. However, every single symptom that he mentioned, with the exception of the chest pain, I experience very frequently, especially like the heart palpitations, and the lightheaded, dizzy, But with that being said, I know that he basically responded to Raven that you have to get checked out, but is there any other health issue that could have those same symptoms before I freak out and think that I need to go see a cardiologist?
Well, you certainly could have heartburn that can lead to some of these symptoms. So heartburn is still, even in adults, is the number one cause for chest pain once you go to the emergency room. But you're being found out because you're in the emergency room. And it's a good thing to have an EKG and a chest X-ray if need be to be screened and have somebody listen to your heart. You
Mm.
might need a heart monitor. Maybe you have something like the long QT syndrome, and you haven't had a sudden death experience, but you're having irregular heart rhythms related to an anxiety. So there's different things that you can have that can be serious situations. Um, going to a doctor, sometimes you might find that your situation is not serious, and that can be life saving for you or life changing for you too, because now you aren't as concerned about those things. But
Hmm.
hopefully, you get a good workup and people take you seriously when you come in and have your complaints, and not just think, don't lead off saying I can be a bit of a hypochondriac, because people might judge you for that, and think, oh, okay, this is going to be easy. It's just anxiety, because you don't want to be missed. You don't want something
Mm.
to be missed. And if you need an echocardiogram, then they can do an echocardiogram and look for it. I will say that um, women's symptoms for a heart attack are different. Sometimes they can be abdominal pain. Um, Sometimes they can be, they're not the typical crushing left arm pain that you hear or read about in men. For whatever reason, women tend to have a different symptom, and they usually have heart disease that comes on for coronaries at an older age than men do. Although if you do have a family history of coronary disease, you should be on the lookout. If you have a history of hypertension and other things like that,
Mm.
your risk factors are higher. So if you tend to be having a situation where you have chest pain and palpitations, um, it's worth being checked out. Sometimes the anxiety, the chest pain, might be anxiety coming from palpitations, because you're thinking, what's wrong with me? I seem to think I'm okay, but the skipped heartbeat is not normal, and that can cause a heck of a lot of anxiety in anyone
Right.
at any age. I get teenagers that come in complaining, and then we get a monitor on them, and they have single skip beats, and it's not a big deal. But to them, not knowing what it is, until they know what it is, it's a big deal. Does that answer your?
Interesting.
Yeah, so it sounds like you do need to take his advice and at least go get checked out, get a workup, and like he said, don't mention that you tend to be a hypochondriac. And just be adamant about it, and get a thorough workup just to make sure, because those symptoms, especially where you're having multiple symptoms, that's it could be something, may not be something, but you do need to be checked.
Hmm. Um, and I'm assuming this isn't something that would ever show up in like physical labs or blood. This isn't something that would show up in blood work if there was an issue with the heart.
Yeah, there are blood tests that we can do to add as a differential diagnosis. So if you have shortness of breath, that seems to be, they can't really tell if it's heart versus lung. We can do something called a BNP, which is a type of protein that is circulating in your body that becomes elevated with heart failure. And
Mm.
certainly, if that number is in the tens of thousands, that's going to be a heart condition. And it might not be a heart attack, it could be a chronic heart failure that you didn't know about, that has gotten worse. Most of the time, um, have you had shortness of breath for a long time, or is this just intermittent sort of things?
I mean, I deal with it off and on just from like my habits, like with smoking throughout my life and stuff like that. But I just noticed, I noticed more since I have more anxiety since I lost my brother, that it happens more frequently. And when I say shortness of breath, I don't mean like just sitting on the couch, I can't breathe, but like just doing small things that I
Yeah.
shouldn't be short on my breath. I'm extremely short on my breath. And I'm sure part of that has to do with me just generally not being fit. But sometimes it's a little concerning because I'm like, all I did was go up 4 stairs and I can't breathe.
Mm.
And how long ago did you lose your brother?
This is my daughter, Dr. Callahan.
Oh, I'm sorry. Okay.
You're fine. So my son, yeah, it's her
Yeah.
brother. We lost him. He was murdered May 15th of 2022.
Okay.
So we've all kind of been going through it for a little while now.
Yeah. Chances are that that should be resolving if it was this sort of thing. But I think it's worth getting yourself checked out.
Yeah.
If some of these blood tests were abnormal, then a greater workup would be done. And if you need medical therapy to help mend things, then you'll be better for it, hopefully.
Understood. Okay. Very interesting. I don't want to hog the whole time, but I have one more.
It's fine.
And I've been waiting for this episode because I'm such a curious person naturally when it comes to like health stuff. But so when someone is in fact suffering from a broken heart, visually through imaging or whatever it is that you guys do, what do you physically see different, abnormal with the heart, or is there anything that you physically see?
Well, with like an echocardiogram, we would see that the left side of the heart is not working well, and it would be in a typical pattern where the apex of the heart is blown out and not working. Other parts of the heart are working. So that's when it looks like this kind of wine jug, or like an old-fashioned wine jug, a Takasubu jug. Is you can look it up and you see what. But that's the shape of the heart. We can see that on an echocardiogram. We can see that on a CT angiogram, so a chest CT looking at your heart with contrast. We would see it on an MRI. We'd also see it on a heart catheter study. So depending upon what people feel the need is, all of any or they can start with an EKG, usually an echocardiogram before any of those other tests. But the shape of the heart would look the same. And then there's other people that have different forms of cardiomyopathy that would have a different shape of their heart. Maybe the entire left heart's not working very well at all. And those things can happen. That can happen from a virus. That can happen from coronary disease. It can happen from lots of different things.
Okay, well, thank you so much. That was very educational and interesting. I really appreciate your time, and this was a fascinating episode.
Good, I'm glad. Did you have any other questions?
No, I asked them all.
Okay.
But okay, thank you. Thank you for coming on. I appreciate it.
You're welcome.
Okay.
Bye-bye.
Bye-bye, Kate. Well, that was really, really informative. I just learned something too. I didn't know my daughter was experiencing those things, so I'm going to be honored, Dr. Callahan.
There you go. She's got good people around her.
Thank you. And so there's another question. So if diagnosed with broken heart syndrome, does that require to be treated with medication? I think you mentioned that earlier, correct?
Generally, if the heart's not working normally, then yes, you would be on different types of medications. Same medications we would use in other forms of heart failure. And in severe cases, like the girl that I mentioned, her heart function was at about 11%. So she may have needed other supports, like sometimes you can put devices inside the heart that can help pump the heart for you while you're waiting for a transplant. I don't know if she had that sort of thing. She may have had that.
Now, is that similar or the same as a pacemaker, or is that different?
It's different. So sometimes we'll actually, it's like being on a small heart, lung, or heart bypass machine that fits in a backpack that you carry with you. It goes through your chest wall and into your heart, and that will support you There's different reasons for that sort of thing, but all of them have to do with a failing heart and maybe a need for transplant. There's many adults who can survive with those without a transplant for a period of time longer than they used to.
Okay. Awesome. Wow. This is a lot of
Unfortunately, in order to have a heart transplant, another family has to go through a trauma.
Yes. Yeah, because it's not like you're just giving up one kidney and,
Right.
going on about your day. Yeah.
Yeah.
Jeez. So, excuse me, it's 6:55. Actually, it's 6:56. We're going to be closing out shortly. If I'll leave it open for one more caller if you want to call while we're waiting, Dr. Callahan. Would you like to share your information if there is someone? I know, this whole group thing is about, us adults with the broken heart syndrome, but you never know if someone out there has a child that is in need of a wonderful pediatric cardiologist. If you want to share your information where they can get a hold of you.
We're at Inova Children's Cardiology, Inova Hospital in Fairfax, Virginia. We have about 20 pediatric cardiologists with another 8 or so coming in the next year.
Yeah.
And so, we're expanding all of our services, and we have many. We have two heart surgeons. If you need to get a hold of us, you can get a hold of us at 703-573-0504. That's our switchboard number for making appointments.
I'll post that number too when we're done. I'll post it on the page. So because some of the listeners, if they're working or not able to see, they can go back and view it. So I'll post the number up so they'll have it.
And generally, if your child is having a concern, you would go to your pediatrician or urgent care. And if they feel that there's a need to see a cardiologist, then we're happy to see you.
Awesome. And Raven says, thank you so much for the information. You really opened my mind to this. Awesome. Great. Awesome. Great participation, excellent information, and a lot of, educational comments and things like that. So I really appreciate you coming on, Dr. Callahan. Thank you so much.
You for reaching out. Yes.
Yes. And I really feel in my heart that you've reached somebody, and I'm hoping that everybody, all my angel moms and dads, let's get together and get healthy and, try to make it through. And Kay says, great show. Thank you for coming on and educating us all.
Well, if you feel that this information could help somebody else, then share the season 1, episode 36 link and help someone else out.
Yes. Awesome. Thank you so much. Oh, this was great. Okay. Well, Dr. Callahan, we're going to go ahead and call it a night. And once again, I thank you so much. You don't know how much this means to me and my listeners. I appreciate you so much.
Welcome. God bless.
All right. God bless you. Have a good night.
You too. Bye.
Well, lovely people, we are signing off. I hope you enjoyed our episode this week. Be sure to tune in next Sunday from 6 p.m. to 7 p.m. And remember, no matter how old or how young, our children will forever be our babies. We just have one with wings. Be gentle with yourself and take all the time you need to heal. Thanks for joining. Good night. Good night, everyone. Thanks for joining.